First of all, good afternoon. It's actually really a pleasure to be here, and it's also nice to see some familiar faces because we've been teaching actually with Chris over the last couple of years here a course on between WFP, the World Food Program, and NYU. So I see some familiar faces in the crowd. It's really nice. I'm going to start off just talking a little bit about where, like, the context around where this report came from. And then Saskia is going to go into a little bit more detail on the actual method and talk more about nutrition. And I think Nyati mentioned that SDG 2, the actual wording is end hunger, achieve food insecurity, and improve nutrition, and promote sustainable agriculture. So it's one of the bigger SDGs because it's got a number of different elements inside, kind of tucked inside. But if you look across all the 17 SDGs, you'll see that number 2 actually links with a number of the other SDGs, because you can't talk about sustainable agriculture without looking at climate change. And you can't think about nutrition without thinking about education, health, and many other sectors. So while it's already a big SDG, it also has linkages across almost all the other 17 SDGs. So if you start breaking it down, so you see there are 4 elements to it: end hunger, improve or achieve food security, improve nutrition, and sustainable agriculture. Already in there are a number of different terms. So you hear the word hunger, and I'm sure many of you hear it. You've heard it before. You've probably felt it as well. Hunger is actually a really complex term because there are social and political elements or aspects to that word, as well as really a physical feeling that is very common to most people. But when we talk about it from a humanitarian standpoint or from a development standpoint, we're really talking about a sustained lack of access to food for a period of time so that somebody can't meet their nutritional needs, kind of, right? But that's not how it's measured. That's the definition of it, but it's often measured in very, I would say, kind of crude ways. So typically when we talk about, as Nyati mentioned, 800 million people are now considered hungry, that indicator comes from basically just looking at global food supplies in a country, or not global, national food supplies in a particular country, and the number of people in that country, and kind of an estimate of how many calories they need. So 2,200 is a basic kind of calorie. And then how many people basically don't have that, just based on what food is available. So it doesn't look at a household level, it doesn't look at an individual level. It comes up with the number of people, but it actually doesn't collect data in that way. So it's kind of this very broad way of kind of establishing hunger. It's an important indicator because it's been collected for many years, and so you can see trends. And as Nyati said, in the most recent report on the state of food insecurity showed that in this year, for the first time, the number of hungry is actually increasing. So over the last 20, 25 years, there's been a pretty steady decline, both in the terms of the percentage of people who are hungry, but also in the total number of people that are hungry. But this year, for the first time, it actually shows an increase. And so I think that's something that it has kind of stimulated. This report came out around the same time that the SOFI came out. So it's important to show and to demonstrate and to start to talk about why numbers of hungry are actually going up. In addition, in SDG 2, you see the term food security. And food insecurity or food security has been defined by basically by what we call the 3 agencies in Rome. So FAO, World Food Program, and IFAD, they're all 3 of the UN agencies that are focused around kind of food and food security. And they've defined food security as basically when you don't have consistent availability and access at all times to sufficient, safe, nutritious food to maintain a healthy and active life. So there are a couple key words inside that, kind of safe food. And that's really important, especially when we start talking about urban poverty and other things. We're not talking about just any food. We're actually talking about safe food, so no aflatoxins, no spoiled food. We're talking about healthy food. It also mentions nutritious, so we're not just talking about calories. So when we talked about hunger and we talked about how hunger is measured, we really spoke about calories. And that's a big issue, I think, in terms of calories going up for many people, and overweight obesity going up, and also still having a large number of people who can't access enough calories but many, many, many more people, both those that have too much calories and too little calories, not getting the right kinds of food. So still suffering from undernutrition. And Saskia will walk us through that a lot more. And then the other key thing inside that food security definition is access at all times. So this is the difference. So there's acute food insecurity and chronic food insecurity. Basically that, many people have access to food at certain times of the year, but then maybe there's a seasonal dip in when they can access food. And then sometimes there's a drought on top of that, so sometimes that dip becomes a big drop. And that means that maybe more people are affected by food insecurity, and the food insecurity becomes more significant, right? So it's not just what maybe would be, because food security is also a little bit on a continuum. So you can have mild food insecurity when you might define that as people tend to not know where their next meal is coming from, and they might consume a little bit less than they consumed previously. Or they might start to substitute certain foods. But by the time you get to kind of moderate food insecurity, then you really have significant shifts. So you might be skipping meals. You might be focusing much more on the quantity of food rather than the quality of food. So you buy rice, and it's at a higher price, so you have to buy, in order to buy the same amount of rice, it takes more of your income. So you can't maybe buy fruits and vegetables or animal source foods, kind of, right? And then by the time you get to severe food insecurity, then you're really talking about, maybe having a meal a day and really not knowing where the next meal is coming from, so really at a significant level. And at the final end of that continuum is what we would probably call famine. And famine is obviously a situation where food insecurity has reached a very, very significant high level. It's usually defined by 3 different indicators. One is mortality, one is the percentage of people that are acutely malnourished, and another one is the number of people who really can't access food that they need. So, a large percentage of people are at that situation. Typically, if you have to declare a famine, then there's already been extensive suffering. So famine usually gets a lot of people's attention, but that's usually quite late, and then we're really trying to fix a problem that's actually quite difficult to fix. When we talk about food security, traditionally we talked about kind of food availability, food accessibility, and then food consumption. And in some cases, some add a 4th one, which is around food stability, right? Stable access to food. And each of those different elements has a different definition, and we can talk about those a little bit more if we need to. But I think what we've talked about much more recently is, instead of talking about each of these different dimensions, so food availability, meaning is the food there, kind of, right? So do you produce it? Do you import it? Do you gather it? Do you catch it? However you have available that food. Accessibility is obviously then much more about the fiscal accessibility. So do you have the money to buy it? But it also can mean, kind of more the access of markets, kind of. So different aspects of that. And then food utilization obviously is more about cooking and preparing and then eating food. And that's obviously also about how well your body can absorb the food that you eat. So if you're ill, you have issues then with absorption. I think we've as a international community kind of shifted a little bit from talking about those 4 different elements of food security and started talking much more about food systems, and really thinking about inputs at the production side, all the way through that process that it would take while you move towards food to consumption, because that allows us, I think, to look at many different actors and to look at that whole pathway and areas where we can actually intervene in that pathway in order to improve that food system. There's also been a lot of shifts over the last 20 years, 30 years in terms of globalization, and food systems look very different in different parts of the country and different parts of the world. So even within the US, the food system in a rural part of the Midwest is very different than the food system in New York City. And similarly, the food system in New York City is incredibly different from the food system in Abuja in South Sudan, kind of, right? And it's also very different from where I was just recently in Ghana, in Accra, and even in Accra, the food system it tends to mimic the New York City food system probably more than the rural Midwest, rural Indiana food system, and less kind of the Juba, South Sudan. But it's also still very different, kind of, right? You can see how it's very different than, and so each of those food systems, if you start to look at them, there are different problems along the food systems, but also people's food systems are much shorter in some places and much longer in other places. So if you live in the rural, your food system is very close. You usually produce it, and what you produce, you eat. And you might sell a little bit and buy something from a neighbor who produced something else. But if you look at our food system is really, really long. We don't know where the food was actually produced in many cases, although it's getting better in the US because it's labeled. But that food goes through many, 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 many iterations before it actually gets into our mouth. So lots of processing, a lot of retail, a lot of markets. And everybody in that food system needs to make profit. Right? So food starts off at a certain price, but every time it's sold and bought or repackaged or processed, money gets added to that because there's somebody in that process who's improving the food and then taking an income off of it. So what it costs at the farm is very different than what it costs kind of down here. But using the food system, I think, really helps us to look at different ways of improving food security very differently than what we looked at the past. And I think that's one of the big things that's happened kind of with the cost of the plate of food, the Count the Bean initiative, is that it is about kind of highlighting the fact that, you know, food comes at a cost. And that there's a huge inequity in the amount of the cost of food, depending on where you are, where you live. But it also has given us an important opportunity as WFP to really show how we work to improve food security now compared to how we did it maybe 10 or 20 or 30 years ago. I think WFP is seen as that photo down there at the end, kind of, right? And in many cases you see helicopters and airplanes when you see WFP, because it's historically the agency that delivered food aid to, you know, to people that were facing famine or some kind of a crisis. But in fact, actually, WFP has shifted quite significantly over the last 10 years. And we now work much more on the food system approach and trying to improve the food system in a particular country. In many cases in the past where we brought in food, we often distorted markets. So sometimes we did damage as well as doing good. Now we aim much more at trying not to distort the food system that exists. So in some cases, food's still important and it needs to be provided, but in many cases, actually, there's a food system in place, and we can actually work with national governments and the private sector and other actors to actually really improve that food system. I think and it's a complex relationship in that pathway between, you know, the production and all the inputs that need to come into the production cycle, the retail, the marketing, the processing, and then finally the marketing towards the products and then the consumption. And each different foods have different pathways in that process as well. So if you think about production, processing, and consumption of grains, how you think about storage of grains and processing of grains is very different than how you think about storage and processing of fruits and vegetables, or even animal source foods. So I think, you know, you have to think about different foods in the different process. And then we also talk a lot about how do you improve the nutritional value of foods through that food system. So we can talk about processing foods, and in many cases that means drying or milling. But if you fortify the food, then you can also add nutritional value to that food as well. If you think about storage of food, if you think about, you know, bins to store grain in, that's really important and can really help with food waste. But those bins won't help you with the vegetable loss, right? The food loss that happens with vegetables. So you have to think about cold storage or cold transportation, a cold chain in terms of transportation. And if you look, I think, in the report, Saskia is going to talk more about the actual how the figures are how they've been developed and the nutrition side of it. But if you look about some of the different examples in the report, you begin to understand and you can begin to see how the different where the different countries' food systems are either not functioning or were not even functioning. But then in many cases there was a crisis that happened in that country, which further disturbed or distorted that food system, right? So if you think about Yemen, for instance, I don't know how many of you know that much about Yemen, but it's been a chronic food insecure country for many years, right? It's one of the poorest countries in the Middle East, and it's had chronic food insecurity problems for many, many years. It imports a very, very large percentage of its food because it's largely desert, and so there's not that much agriculture production. A lot of people depend on agriculture production as a livelihood in Yemen, but it doesn't produce enough food for itself, and traditionally it's imported a very large share of its food. So when the crisis hit in Yemen, basically that entire the importation part of the food system was drastically interrupted, because ports were blocked, roads were damaged, things that were allowing for that distribution of food to happen basically were completely interrupted. And that had a big impact then on basically access of food that for people that were in different parts of Yemen. If you look at South Sudan, it's a very different situation, because in South Sudan, again, agriculture, it's a big agricultural country. It's actually got a lot of potential. There's a lot of resources in South Sudan, but it's a very new country, lots of conflict from even when it was first developed or first became a new country. But the problems in South Sudan, there are hardly any roads. If you go to Juba and you just arrive in the airport, and from Juba you go to our WFP office, you don't need to see anything more to know what you need to do in South Sudan in terms of food systems. The potholes from the airport to WFP are so enormous that you really, you feel like you're almost on a roller coaster, kind of going from the back road, the feeder roads to get into our office. In fact, we had a head of programs who was assigned to Juba, who had some problems with his back. And essentially he went to Juba, and after 2 weeks he said, you have to reassign me because I cannot go every day to the office on this road, basically. He had to go out to meetings and things like that. The feeder roads in South Sudan are just, you can't imagine, but if you see it in Juba, then you can't imagine what's further out there. So the problems in South Sudan are actually very different. The problems in South Sudan have to do with really being able to distribute food, and having roads and infrastructure, bridges to be able to distribute food. And then in the rainy season in South Sudan, in many parts of the country, that distribution system, those terrible roads that exist, basically become almost impossible to move. So you have to pre-position food, you have to move food out. And so there, in terms of working with retailers and thinking about working with markets, you have to start really thinking about the infrastructure that needs to be built in order to even have markets going. In Uganda, it's also very different. In Uganda, there's much more infrastructure, but there's a huge amount of post-harvest loss that happens. Nearly 30 to 40% of all the food that's produced in Uganda is destroyed. It's bad, basically, right? It's lost. And so there, you don't have to. It's not the production, kind of, right? It's much more in the processing period, in that processing and in the storage and like storage of food. And so there we've actually worked with these new silos. They're very small, kind of, you can use at the household level or at the community level silos, where households are able to store their grain. And what happens with that is two things. One is if they are producing just enough kind of for themselves, it means that they don't have to sell everything at the beginning and then 3 months or 4 months later buy back cereal to eat at a very high price. So they can actually store their food and it's safe and they can eat it throughout the year and it particularly in the lean season when it becomes much more expensive. And if they produce a little bit of surplus, they can actually keep that grain and sell it when the price tends to go up, right? And so they can make a bit more income and actually be able to move themselves a little bit more out of a level of poverty that they were in. So I think helping, seeing that looking at the food system, analyzing it across many different countries has really helped WFP in terms of not just delivering food, but actually looking at how we can use cash and vouchers, how we can help strengthen the food system in different countries at different stages depending on where it's weak. And we can also start working much more, I think, in terms of preparedness, because we can start to look at countries that are at risk of famine or at risk of food insecurity or at risk of crisis and begin to see already where that system is going to be strained and where those inputs might be needed and how we can move forward. I'm going to stop here, I think, and I'm going to pass it on to Saskia. She's going to talk a little bit more about the nutrition side.
Yeah, so good afternoon. Really nice to be here and to have such a full room. As Lynnda said, I'll talk more about the publication itself, about the different metrics in there, and make a link really to the deepen the discussion on nutrition. So my background, I studied biomedical sciences in Leiden. Then I did a PhD in nutrition research in Indonesia on vitamin A deficiency, that was. Then I worked with Helen Keller International for 10 years as a scientific advisor. And then I joined the WFP a little over 10 years ago. So really my work is between science and evidence and numbers and then implementation. So I'm really trying to bridge, but it's a really big area. And now I'm leading the Fill the Nutrient Gap team, and I'll show something about that as well, where we really try and bring nutrition into policy and see what we can do. So the publication, Counting the Beans, and some of you may have read it, may have seen it. We've got, of course, some displays here. Maybe if you can give me the first one, Lynnda. So it's really to talk about what is the true cost of food. So this started with a discussion at the World Economic Forum in Davos. And to really get people to think about food and about access to food in a way that brings it back to kind of your own situation. So they developed a metric. But first, just a little bit of an estimate. What proportion of income do people spend on food? In poor countries, would it be like 20%, 50%, 70%? Who thinks less than half is for food of poor people? No. So I think most people think really food cost is more than 50%, yeah. So the poor typically spend about 70% of their income on food. So it's really a huge expense. Yeah. So with this cost of a plate of food, and you've got the full one on the board here. It's nice to look at. What's been done is said, let's have a look at the cost of a basic plate of food. So now talking a bean stew together with a source of carbohydrates. So it can be maize, can be wheat, can be rice. And what does that cost in terms of proportion of people's daily income or daily money they have available to spend? And if we express that as a proportion, and then take that proportion from a New Yorker's amount of money available for daily spending. So this has been done on the GDP. So for New York, $200 a day is the amount that people have available to spend. That's the metric that was used. And then here you see what it would actually cost if, with this New York income, you had to spend the proportion that people actually spend in those countries on one plate of food. So we're not even talking 3 meals a day and a few snacks and some drinks. Talking just one meal. You see in Guatemala, it's 4%, so it's $8. In Yemen, it's 46. In Nigeria, it's 72. And in, we got South Sudan here at the bottom, yeah. It's South Sudan. You know, one meal is 155% of what the person has available to spend in a day, so it's not even possible. So here you really see how cost of food is actually a major barrier. And with this metric, you can then start to analyze where can the priority be and can we understand why the cost is like that. And it's of course the cost of the food and it's the income. It's those two together, right, that need to be come together somehow. On the next slide, you know, this shows it in a different way. So it shows the average daily income and then that cost for one meal as a proportion of that daily income. And you can already see the countries where the share is the largest. What do they have in common? So we're talking South Sudan, Northeast Nigeria, Syria, Somalia, DRC. Sorry? Yeah, why would that be? Why is it those countries that show that? Yeah, so conflict is a major driver. But we also, for example, see here Malawi with 45%. So it's also really, really high. And as Lynnda already explained, if you analyze the food system, for example, in, I don't think it's on here, no, Uganda, the cost is also proportionally high because of a large amount of losses. So there's different factors that drive cost and access to food. So with such an analysis, you can then look at strengthening food systems. Now, so from here, I'd like to now take it to fill the nutrient gap. So what we do with fill the nutrient gap is that we want to do a situation analysis to see what underlies a nutrient gap. Now, why is a nutrient gap important? Malnutrition has two causes, right? So it's about consuming the nutrients we require to grow, to be physically active, for our immune system to perform. So we need many nutrients. We need iron, zinc, energy, protein, fats, lots of different ones. So we don't just need food or a meal that we enjoy eating, but we need food that gives us the nutrients that we require. And we need to be healthy, because then we can use the nutrients that we consume. If you have diarrhea or you have a fever, you lose nutrients also. You don't absorb them as well. So if it's, now those are the two direct causes of malnutrition: an inadequate intake of nutrients or the wrong balance, and health. So nutrients come from foods. So if you want to unpack what actually affects whether we have an adequate nutrient intake, we must look at access to nutritious foods. And then we must look at the food system, because the food system supplies the foods. And at the country level, with our SDGs, with the Scaling Up Nutrition movement, everybody is starting to get involved in nutrition. Everybody, or many people, understand that nutrition is important for development, it's important for health. So we want to achieve good nutrition. So the question is, how do we achieve good nutrition? So with this exercise of situation analysis and decision making, that is really where our focus lies. It's about, we need nutritious foods, so let's unpack that so that we, through that, can assess where the focus can be for players in the food system, for players in the health system, for players in the social protection system. So we'll go through a bit of the framework for that. And then I'll give you an example from Pakistan, how we've used the analysis there. So it's about, you start with an identification of the issues. We sit together at a national level. We go through a champion in country, like the Sun Focal Point. They've got their structures, so they bring the different players together. And we go through what is the fill the nutrient gap analysis? What do we hope to learn from this? Are you interested? What have you got in terms of data and information? Where shall we focus? Typically, the focus is pregnant women, lactating women, young children. We want to break the vicious cycle, so a lot of attention goes there. But it is also school children can be a major focus. There is a whole lot of systems and environment that is important, so the analysis focuses on that. And then we really go deeper in the nutrition analysis. So we look at trends in malnutrition, we look at access to markets, we look at production figures, we really review a whole lot of secondary data. So there's no primary data collection. It's all gathering of information that's actually out there, but may not have been looked at all together. The analysis has not been done in that way. And then we come to a decision-making step. We put all the evidence or all the information together. And then the stakeholders together decide for their systems, where they play a role, what they think the priority should be, where they can focus in the short term, medium term, and longer term. Yeah. So as I said, it's about reviewing secondary data and sources of information. And often we start the analysis already back at our desk in Rome, because you can find stuff on the internet, of course. Then we liaise with the country office. We hear from them what sources of information are available. And then in country, we liaise with the stakeholders, and then we get further information again. So it's a whole level of every time getting more sources of information. You found a few things, you share that, and say, oh, but then that is also something relevant. Let me bring you that. And then there's a linear programming component, cost of the diet. That's in chapter 5 of the Counting the Beans, results from that analysis. And there we look at what does it cost to have a plate of food or a diet in the day that meets just energy needs, and what does it cost to actually meet all the or most of the nutrient requirements. And so we compose a household. We say, okay, there is a breastfed child, 1 year old, there is a lactating mother, there is a father, there's a school-going child and an adolescent girl, and each of them has a certain nutrient need. Then food prices and food composition, that goes into the tool, and the tool will select a diet based on these local foods that at the lowest cost meets those nutrient needs of all those people in the household. And that cost we then compare to what people can afford. And we do that with a life cycle approach, as I said. So we've done it now in about 10 countries. We started with pilots in El Salvador, Ghana, and Madagascar. Then we've done a sort of a focus on Asia, and are now doing more in Southern Africa. The team this week is starting in Rwanda and Uganda. And I'll give you some information on the analysis from Pakistan. So the process in Pakistan, it had a bottom-up approach. It started with contacting the Sun focal point. And Pakistan is very decentralized. So every province, they have their own governance, they have their own decision making, their own budgets, and at federal level, they try and support the provinces, but the provinces take the decisions. So at those levels, we asked for information, we did cost of diet analysis, and in the end, we ended up with 190 secondary sources of information. And the stakeholders, they brought all these data and information to the team. And then when we had made the first digest, we went back and we shared, this is the picture that's transpiring. Does it make sense? Do you have other information that's relevant to look at? And they were really interested. They said, wow, this is such a lot of information we have. We're such a data-rich country. But it's really good to see it come together for an analysis like this. So of course, you can imagine if you review so many sources of information, the first set of slides that told the story was like 200 slides, and we were looking at it together in the office and said, wow, how can you still see the main point here? So we're now about to have the summary ready, and we'll have like 12 key messages in that summary with snapshots of how did we come to those messages, but there's a lot underlying that story. So the key messages is that the affordability is the greatest barrier to achieving a nutritious diet. So we found for Pakistan, 68% of the households cannot afford an adequately nutritious diet. And it was like 4 or 5% that cannot afford to meet energy needs. So it's not about filling the plate really, they are able to fill a plate with food. But it's about having it adequately nutritious for the different household members. Then undernutrition in infants and young children starts already really early. So at the age of 6 months, there's about 23% of stunting already. So that means that it's not just about what are the children eating, but it's when do women become pregnant. So there's a high adolescent pregnancy rate. So those kids are at a higher risk of undernutrition. And then, there's other factors that also affect what the mom can and cannot eat. So we really have to focus on the women as much as on the children. Urban undernutrition is there. And at the same time, there's an increasing prevalence of overweight and obesity. Now, overweight and obesity doesn't mean that people have a lot of access to food. It basically means that their diet is still unbalanced, poor in the essential nutrients, just over on the calories. So micronutrient deficiencies, they are across the whole spectrum, and therefore they're still malnourished as well. And both the quantity and the quality of the dietary intake is a problem. And then there needs to be continued promotion of strong and consistent enabling environments. So this is really at the government level and at the different sectors of the government. You know, nutrition, if we talk 20 years ago or so, nutrition was under the Ministry of Health in most places. And the Ministry of Health and the health sector, you can give supplements, or you can give nutrition education, but you don't really give food, and you don't interfere with the food system. That's kind of separate. So what we're trying to do here is really to bring it together and to say the ultimate outcome that we're after is an adequate nutrient intake. We don't want to prove of every single intervention that it reduces anemia, that it prevents stunting, that, you know, all those outcomes will come, but we must first fix nutrient intake. So that's kind of the novel focus of this approach. Next one. Yeah, so we've been able to, with that cost of diet, it's a linear programming tool, it's really nice. You can do lots of modeling, you can change all sorts of parameters. So what we do in Pakistan, for example, I'm not sure it's on this slide actually. There was wheat flour fortification going on, and they were thinking they should actually align their specifications with the WHO specification, and they were interested to see how much of a difference that would make in meeting the nutrient requirements. It's a thing we did, for example. Then there's production of specific more nutritious foods, so we tested what that will do. There's a social protection program with cash transfers. So we did a modeling of how much of a difference does such a cash transfer make. And what you can really see with all these different analyses is that there's no single sort of silver bullet. There's nothing that will just fix the whole thing. You have different target groups that you should be doing something for, and you will see that your population, some have a small gap in affordability. So you may want to see what you can do for them. Maybe they live in urban areas, and you have other areas where people are, the gap is much, much larger, so a different approach may be required. So this helps to grasp it more and to become more concrete in what can be done. Next one. Yeah, it's fine. Yeah. So what did this really contribute, the fill the nutrient gap in Pakistan? We did it at a moment that the multi-sectoral nutrition strategy was being defined, redefined. So this really helped to refine the thinking for that process. It brought to the forefront all that information. So all these 190 sources of information, it was so rich actually, that they really appreciated being able to combine that all together and see how they could go forward from there. It gives practical contextual solutions for Pakistan. If you look at the Lancet series, 2013, you have nutrition-specific actions, you have nutrition-sensitive actions, and now you're in a country and you have to decide what to do. You know, all the countries are so different. Some are middle income, some are low income, some are very dispersed, some aren't. So you really have to contextualize those interventions. So that is what this is about. So now the government of Pakistan, they have some very specific things that they're working on, and they're feeding this in, and they see many opportunities. So going forward, the WFP offices and the SUN offices and the different stakeholders, they will continue to use parts of this analysis. And we are very interested to see what exactly they are using and how they're going forward with those. And the same for the other countries where we've done it so far. So, yeah. So if you want to know more, there's the FEM shop of WFP. This is our vulnerability assessment monitoring unit. They have kindly hosted the outputs of our team. This is the way to find it. And we've done a webinar with Secure Nutrition. That's a platform from the World Bank. That's also available online. So if you'd like to see something more, here's where you find it. So I'd like to hand it over to Chris.
Thank you, Saskia. Okay, so I'll be fairly quick because I think one of the great benefits of having Saskia and Lynnda here with us today is it'll give all of you a chance to meet them and to see how you might become involved in some of this work. So what I'd like to do now is to tell you a little bit about this very important and valuable partnership between the College of Global Public Health and the World Food Program. It is very, very important. It's about 2.5 years old or so, and we started with a course that's called A Systems Approach to Food Access. And the course was developed really to address this idea that an agency like the World Food Program would benefit quite a lot from the academic foundation that we can provide at NYU, and also the ability to create an environment to allow some innovation to take place. And so the course that we designed, together with Lynnda and Saskia and Divya, who's here now, and Martin Bloom, who is just retiring from the World Food Program, and Bernadette Bowden-Albala, who many of you know from the College of Global Public Health, and Joyce O'Connor. And the course that we designed was really, it's called A Systems Approach to Food Access, and the idea there is to look at complex outcomes like stunting or undernutrition or even overnutrition in a context, in a societal context. So what are the drivers of that? Are they political? Are they economic? Are they geographical? Are they cultural? Because if you see a group of individuals who stunted in a population, what it means is that the system failed. It's not because of one particular aspect of that society. It's because a lot of those pieces have to break down. And so if you look at the problem as a systems approach, you can start to think about possible innovations to address that. So we ran the course the first time. We brought in 15 or 20 people from around the world. We mixed them together with your compatriots. Some are here in the class. And Leslie, you were in the first class, is that right? So we had, and it was really quite dynamic, because when you mix people from the field together with students, it's frightening at first for both. I think it's not something that either group is accustomed to, but it does turn out to be quite magical, because our students do have quite a lot of foundation academically. We have a lot to contribute, and they have, of course, have a lot to contribute by working in the field for 10 or 15 or 20 years and dealing with these problems firsthand. And so the course was a big success. We've now run it 8 times. We've trained something like 120 of the senior staff at the World Food Program, which represents almost 20% of the senior staff there. And the way we've designed the course is to really get everybody to think differently about these complex challenges. So if you start to think about it in terms of a systems approach, you can start to think about where you might intervene and where you might end up with unintended consequences or intended consequences in many cases. And so in the times that we've run the course, we've now had dozens of projects that have been successful. One was able to get funding from the Canadian government. We ran it in Madagascar. Milena was part of that group. It was a stunting reduction program in Madagascar. Milena went there. We have a program that is being implemented in Indonesia that came out of the course. And we have a couple programs that I want to tell you about here, and then I'm going to encourage you, if you're interested in this topic at all, to stay focused and to stay with us, because there are lots and lots of opportunities for you while you're here at the college to be able to do this kind of work. So one of the projects came out of the course. It was in Senegal, looking at stunting reduction. Now, Senegal has been very successful in reducing stunting. They've gone from, 40% to under 20% in less than 20 years. But the government is still quite concerned about pockets of stunting in very deprived groups there. It's a progressive government. And so our group, in fact, the team that was working on Senegal in the course presented to the government a systems approach and a bottleneck analysis. So bottleneck analysis says, all right, is the problem because the proper nutrition is not available? Is it because it's available but not accessible, either geographically or financially? Is it available, accessible, but maybe not acceptable? Maybe it's not the right mix of foods that people are accustomed to eating or know how to cook or are comfortable with. Or to Lynnda's point earlier, is it all of those three things, but just not there when they need it or there all the time? Is it not there continuously? And then finally, is it Is it available, accessible, acceptable, continually there, but at a high enough quality that it'll really be meaningful in terms of making a difference in somebody's nutrition? And so those bottlenecks are sequential, and we can analyze those to see which are the priority bottlenecks that we might want to get involved in trying to address. And then once you've done that, you can start to look at strategies that might be successful, and you can look at the estimate of what the impact would be if you deploy strategies to address these bottlenecks, and then you can cost it out and see whether or not it's something that either an agency might invest in, or a government, or a foundation to be able to support that. This is something you can all do. This is something that all of your classmates did as a part of this course. And so when we presented this to the Senegalese government, they had representatives from every county there, from every agency, from every ministry, and they were struggling because they had a number of programs that were dealing with undernutrition across the country, and they hadn't yet seen how to maybe put them into context. All well run, very well managed, but when you start to look at it in a systems approach, it becomes very clear that you might be over-investing in some parts of the problem and under-investing in others where you could make a major difference. So when the presentation was over, they came to us and they said, look, we really could use a little bit of help. And it's not like we're telling them what to do at all. We're really helping them create the systems map on their own. We're helping them look at the bottlenecks to see where they might be prioritized. And we have a team of your classmates going there in January to do just that, to go to Namatam County in January with the country office at WFP. We have another group that's been working on a school feeding program in East Africa to look at the costs and the benefits associated with providing school meals. And so in Ethiopia, there are two regions that are looking at homegrown school meals. We're working with local agriculture to provide nutrition to students, subsidized by the World Food Program and by the government. And so the cost-benefit analysis that's been done together with the Boston Consulting Group and Mastercard shows that it's about a $7 per $1 investment. So for every dollar that you put in, you get back about $7 in productivity and benefits. We actually think that's probably an underestimate. We think that they haven't properly brought in the health and nutrition benefits that are associated with that. So we have another team of your classmates that are working on just that problem, and they're going to be going to Ethiopia in January to look at that, to help the government and the WFP understand that. So, and there are no shortage of these projects. We have probably dozens more. If we sat here for 10 minutes, between Saskia and Lynnda, we could come up with a dozen more projects for you to be involved in. So I really strongly encourage you, if this is an area that you're interested in, to take advantage of this unique and strong and very, very valuable partnership between the college and the World Food Program, because it could really determine what you might be doing for the next 10, 15, or 20 years. So I'll leave it there. I'm enormously grateful to WFP for giving us this display, for giving us this opportunity, to Niati for setting this up, to Saskia and to Lynnda for giving us their time on this panel. So thank you very much.
All right, so happy to take some questions. We have a couple of mics. Jackie, would you mind circulating them around as needed? Yep. So I'll hand over the mic to the panelists, and Jackie is going to be passing around the mic as you raise your hands. I just want to also say that when I was first talking to Shaza about this, she said that they were trying to get this exhibit up in Times Square. So I think we're very fortunate that we can have this here first. Grand Central, sorry. One of the major places. And anything else that I might say about this that I'm missed out on? Shaza, come here, introduce yourself and say something.
Hey everyone, just introducing myself. So I'm Shaza Maghribi. I work as a communications consultant with the World Food Program. I'm really happy to be here, and I think this is a fantastic place to host this exhibition here. I just wanted to emphasize on something. I think it's really important. One of the biggest takeaway from this study is how we can actually see how the disparities in food costs, how conflict can impact the cost of a simple plate of food, and how we can preempt, a lot of the factors that would cause food insecurity in some areas. But why we're here at NYU is because we think that you can help. You have a major role. You have a voice that we would like to have it heard. We want it to be louder. I want you to have a look at the exhibition. It's very self-explanatory. I think, you know, you'll have a look, but we've got some lovely ladies who are helping out and volunteering to provide more information. So feel free to reach out to them. But we also need you to raise awareness on this study and raise awareness about the issues of food insecurities and the conflicts that are happening around the world. I think basically, Nyati, we were talking about you know, some opportunities as well in volunteering, but I think Chris was mentioning a lot of the programs where you can actually contribute in. And I think, you know, this partnership with NYU, I hope this is going to be a start to other things, more engagement between WFP and NYU. And I'm looking forward to sitting down. Anyone who's interested or something, you know, you can contact some of the ladies, Lauren, Tanya, Emily. So happy to share any information.
Thank you. Question time. Questions on anything, careers, the study, the report, their talks, their jobs, all of it.
Thank you very much.
Give us your name and your concentration and what you're in.
I am no longer a student.
Oh, great. That's good to know.
So
too.
I'm in the new global health section at the NYU Medical School. And one of the big focuses is going to be around obesity. And so I was wondering if you could talk a little bit more about what WFP is doing in this space and how the fill-a-nutrient gap is leading to countries designing different programs or approaching this in a different way.
Okay. Yeah, so I guess WFP's mandate is largely around food insecurity, and so there are a lot of times internal debates about should we be involved in overweight obesity. It's quite easy to see that if somebody doesn't get enough food, that there's a human right, a moral imperative, you know, to ensure that people get that food. When someone is overweight, then it's a very different type of a situation, kind of, right, in terms of what would be WFP's role in that. But having said that, like I was saying earlier, you can't separate really undernutrition and overnutrition. You can't separate people working on maternal child health from people that are working on NCDs, right, non-communicable diseases, because basically we're reaching similar people, similar communities. And so we really need to work a lot more on how do we bring these two, you know, kind of these two different separate crises kind of together. I think the reality is that there are as many overweight, obese people as there are, like twice as many. So there are 800 million people that are hungry, and there are basically 2 billion people that are overweight, obese now. And so we're fooling ourselves also to think that this problem of overweight obesity is not actually going to make the problem of undernutrition even more challenging and more difficult. Because right now there's enough food in the world to feed everyone, but at the rate of increase of intake of the globe, of the world, we won't have enough food very soon. And so an agriculturalist would say, well, then let's go out and produce more food. And a nutritionist would probably look at it and say, well, let's try to figure out how we make sure that everybody consumes what they actually need. And so I think there are definitely very strong links between these two. And we, you know, I think we're involved more and more in that. In Indonesia, for instance, we're involved in looking much more at marketing of good nutrition. So I think one of the comparative advantages of WFP is working with the private sector. Typically, we've bought food and move food for the last, 50 years, kind of ever since 1960. So in the last, 50 years. So we work with the private sector every day. Most of the other UN agencies don't work with the private sector regularly. So I think we have a really strong, good opportunity of working more effectively with the private sector to make sure that what they do, what we do, is actually really contributing to good nutrition, rather than either over or under. A large percentage of people who are have overnutrition, as Saskia has mentioned, many of them are also micronutrient deficient, so they suffer from anemia. So they're not necessarily, they may not be hungry, but they're also still in a way, they're food insecure because they're not getting the right kind of food that they need for a variety of different reasons. Yeah.
A question?
Yeah, I'll give a second reply or an additional reply on what we do with the filter nutrient gap also, with the modeling, for example. We've done it in a few countries. We've looked at what snack foods are bought, for example, for children. So then in the model we can say, okay, part of the calorie needs are already filled by the snacks. So we'll enter some snacks that we have found to be typically consumed, and they cost so much. Now, if that portion of energy needs is already covered by those snacks, which are basically empty calorie foods because they don't provide your essential nutrients, just your energy, that means that the remainder of the diet now has to be extra nutrient dense. You know, the amount of nutrients in 100 kilocalories has to be even higher and more expensive. So then you can see that it further increases actually the cost of ensuring that you meet all your nutrient needs. So that helps also to sensitize that, oh, really, if we had some people like to snack, but if those could be nutritious snacks, you know, that would be much better. So then you can engage, as Lynnda says, the private sector and other players to say, you know, there is this habit, there is this consumption pattern, there's convenience, many things play a role. But if we can now make sure that what is there is more nutritious and still affordable, then we really gain, because we want to prevent such a big increase of overweight and obesity, and we see the trend going in that direction already. So, yeah.
I just want to add to
question on.
I just want to add one quick thing
Okay.
to what Lynnda said. Teaching and reading about global nutrition. So the new terminology that I've been reading about is the triple burden, right? You see overweight, undernutrition, or malnourished, and the triple burden is people who are overweight but still have these deficiencies.
Question finally.
Please.
On climate change. So going forward, perhaps one generation will have 1 degree centigrade more than today, probably 2 degrees centigrade. And we're going to have increased droughts, particularly in the Sahel of Africa, the Middle East, North India, Pakistan. And we're going to have an increase in population, probably 1 billion more folks, especially in those regions. And with an increase in temperature, we're probably going to have a 5 to 10% reduction in the grain production, probably more pestilence, plus the storms. So we're going to have extreme dislocations. And from 2050 to 2100, things will probably even worsen. Could you give us some idea of your planning for the next generation with all of these threats to our nutrition and perhaps even our survival?
Yeah, not a small question, kind of, right? So I think that I think what you lay out, I think, is obviously, you know, that's where we're moving, and I think that's the big fear of the overconsumption that's happening globally. If you look at it in the context of where production potential will be 30 and 50 years down the road, kind of, right? Because of the factors that you've identified. Because what climate change will basically do is increase inequities even more. Because areas where that will be hit the most by climate change are areas where the situation is already quite bad. So I think that's something really important. I think when you look at food losses, and if you think about how if we can just eradicate food loss, the amount of food available will cover a lot of what will happen over the next 20 to 30 to 50 years, kind of, with climate change. Because right now, if you realize, we lose almost 30 to 40% of all the food that we produce. So just minimizing that, or if we could, removing any, just eradicating food loss, would actually create a huge potential, we would have surplus. And we can think more about that. I mean, I think there's also a lot of research going on around the fact that a lot of production is also linked with increased animal intake. because it's a lot more to consume a piece of meat than it is to consume, kind of an equivalent if you think about it in a vegetarian diet. And I think there too, we need a lot of thinking and work around it, because there we think about demographics. Young children really do need animal source foods if they really want to grow effectively. There have been studies that show that, raising a child on a vegan diet actually has impacts on their growth and their development and other things. So there are certain life stages where animal source foods are actually really important. But there are other life stages where we don't need to eat animal source foods every day, for instance. And so I think just, kind of global education around, both for those of us that probably already overconsume animal source foods, but even for countries and populations where they desire to eat, similar to countries that are eating that way, they don't even know that that's really not necessary. So if we can, kind of adjust that transition, then I think, again, we'll be able to maximize kind of production towards better nutrition in ways that we currently aren't. There's a lot, I think, also that we need to be doing in preparedness around conflict and around natural disasters that we don't do. So building much more community resilience, building household resilience, looking at ways to, because once there's a disaster and once there's conflict, then we're always catching up, and it becomes much more challenging. Once we have so much data available to us now that we didn't have 10, 20 years ago. There's ways to predict where things are going to happen, and like I was saying earlier with the food systems and all, we can identify where there will be problems. We can actually do much more in terms of prevention in that food system, much more in building resilience around it, that we don't wait until it's happened and we're trying to really, to play catch up on it. So I think that there are definitely ways. I mean, there's obviously a huge global call to improve or to reduce contributions to climate change as well, kind of, right? And so we're obviously sitting in a country where that's a big challenge right now. But I think it has to, we have to focus on both ends. So countries that are, obviously contributing greatly to climate change need to continue to do much more to lower those, lower their inputs. But I think we also have a lot that we can do with countries that are actually changing, and how to make that transition actually much more climate oriented, kind of, right, rather than how many of us in the northern countries have kind of proceeded over the last 30 years.
Yeah, okay.
My name is Irene. I'm in global public health, concentrated in nutrition. I'm just wondering, what is it like working in WFP?
No, I really like it for two reasons. The UN is big, right? And well, you've got the headquarters here, and there's some agencies that are norm setting, and they go with all the countries are basically their board and influence the direction of the organization. WFP is we have an urgent tasks all the time, so we must act. We can't deliberate too long. So many of the people are very much focused on let's do something that is best possible and then maybe adapt it. So that always having a very good link with what goes on the ground and being there and wanting to do something sort of as soon as possible. That gives a way of working or an environment that's really nice, I find, to work in. You want to add, Lynnda?
Just one addition. I think Saskia and I have both worked together for a nonprofit, an NGO. And I've worked with NGOs most of my career until the last 8 years when I started working with the UN, with the World Food Program. And I think, they're both different. There are advantages and probably disadvantages with both. When you're working with an NGO, You tend to be on the ground. You tend to be working much closer to communities. And there's probably, in some ways, maybe more freedom in what you're doing. I think we did some of the best work that we've done, that Saskia and I've done, and with a couple other colleagues, really with an NGO where we were able to really try new innovative approaches and be able to look at how it happened. Sometimes we were 10 years ahead of kind of where people are in terms of their understanding of food security and nutrition. And it's interesting to watch it kind of come later. I think with the UN, what you do have that you don't tend to have with a nonprofit is that you have scale. And so when you do something and you work with the UN, I mean, we have country offices in 80 countries, and we reach 80 million people directly every year. So if we do something well and we find something, we can really take it to a relatively large scale within country, as well as across countries and across regions. So that doesn't always happen so much with smaller nonprofits. So I think that's one of the things. I mean, it's obviously also then huge accountability, because you can be doing a lot of the wrong thing, on a big scale as well too. So that means also that you do need to be conscious of doing the right thing and doing the thing that you're doing correctly. I think, yeah. And I think also with the UN agency, there's like with every agency, there's different levels, right? If you're at headquarters, your focus is a certain thing. If you're sitting in the New York office here, then, the role that you play within the agency is also quite different. If you're at a country office, or even, we have many sub-offices, so we have field offices in the country where, they're really on the ground kind of much more closely, but often working with a government who's actually implementing, or working with with a nonprofit who's actually implementing. So different advantages and disadvantages. I would highly recommend always moving across different, so work for a nonprofit for a while, go work for the UN, go work for a donor, come back and work for a nonprofit, work for a donor, because what you are able to offer changes. Work with the private sector also in between there. What you're able to offer each of those agencies at different phases of your career can be very valuable, both to yourself and to the organization that you're working for. And I think it also keeps one from becoming maybe a bit jaded, working kind of with a particular type of agency.
And academia as well, hey? Work in academia too. Yeah.
Okay. Hi. I actually work for. Oh, go ahead. Hi. So I work for a nonprofit here in New York City in the Lower East Side, and one of my questions is, so I do a lot of the health and wellness programming at our organization, and we're looking at healthy neighborhoods and also community development. So one of the conversations we're having is how to take the systems approach in New York City. And I just want to get your perspective of the international approach, and are you seeing more the education helping and getting and achieving your outcomes, or is it more having these tough conversations with the system to kind of address, infrastructure, technology, affordable housing, that kind of thing? What have you seen internationally?
Yeah, very nice question. I see, so through the work, you can tell individuals or households what best to do, but it's really about enabling those households, in what situation do they find themselves, and how can you make that system move towards doing more for them, making more things possible. When we got at this of the cost issue, for example, say, yeah, it's nice to do nutrition education, to say what should be on your daily meal. But if the cost is actually prohibitive, what are we talking? We rather make sure that the foods become more affordable and that there's proper support for increasing income. Then you can start talking about what choices to make. But if you have no choices, what's the point of working on that one? So I think systems are really essential. And also on the overweight and obesity side, now a professor in the Netherlands who's now really focusing on working on the system in Amsterdam through schools and through neighborhood programs to really help make the environment different, and therefore have a different situation for people to make their choices in. Chris, would you like to?
I do think it's relevant here for New York City to think about the complexity of a neighborhood on the Lower East Side, for example, because the reason people are not getting proper access is just not straightforward, and especially here. So I think it's very, very relevant. I think it would be interesting for you to maybe sit in on a couple of our classes just to see what you think about. Are you a student here as well, or are you? Oh, well, then sit in. I think you'll have a good time with it. Or talk to some of the students and see what they think. But I do think it's very, very relevant, and I don't think everybody that wants to do global health has to leave New York City to do that. Right? We have, in fact, you can get just the same challenges here, just a few blocks away, that you might find in Juba or Accra, certainly, or Dakar, or some of the cities that we deal with.
Hi, my name is Corbin Kapler. I'm studying global health here. My question, going back to the data a little bit, in the countries experiencing conflict, war-torn countries, it's obvious, or it makes more sense as to why they're down towards the bottom. But have we seen examples of countries that have taken steps to successfully combat some of these issues? And what does that look like, or maybe what countries kind of leading the way in that?
You mean countries, conflict countries that have tried to combat it, or just in general, kind of non-conflict countries? Yeah. So no, it's not. I think, and largely this is kind of, it's an advocacy tool, kind of, right, to really show that inequity. And I think back to the earlier comment about New York City, I think it's maybe New York State is where we came up with $1.20. But if you actually if you looked at New York City, you would probably find huge diversity within the city. It's not one number, kind of, right? So it's also, that is our reference for looking at other countries. But within New York City, you'll find huge variability, and it probably gets pretty far down on this chart for some households as well, kind of, right? But yeah, definitely. And I think, the thing is that this is the issue around conflict and disaster and humanitarian crises. The more you can do before the crisis hits, in terms of understanding the systems, the better you can prevent the huge damage of that crisis, kind of, right? So when a country's in crisis, you end up, it's really Band-Aids. You're really trying to fix problems that exist, and it's very hard to actually step back and look at the bigger system and analyze it. And I think when you're in a country like Uganda, where there's some conflict up in the north, kind of in Karamojo, but manageable, kind of. There you're able to really look at the system, and that's when they came up and they really found that they have fairly good production, but they still have a lot of malnutrition. And they looked at that food system, and they saw that at least 40% of cereals and probably even a higher percentage of other foods they're lost. And so they don't have to focus as much on inputs and production, but they do need to focus on that, on the losses. And what they've started to do now are, and Saskia had a picture actually, there are these small grain bins, kind of, right? They're plastic. They're made in a certain way that actually you can keep grains for, I think they've said up to maybe 8 years, you can actually keep grain in these small plastic bins. They're affordable. Most households, or like maybe joint households in a community, within 1 or 2 years, they've completely paid off the storage bin. So it's a small investment, kind of, right? You can share that investment across several households, and then you can buy within a year or two, each can maybe have their own kind of plastic bin. In Latin America, they've been doing this for decades, but it's never gotten transferred to Africa. And essentially, what we see is that you have a food impact, because you can keep your food and you can eat it year-round, so you don't have that window where you don't have enough to eat. But you can also sell it at higher prices if you make a little bit more, like I was saying earlier. So there's an income effect. That means that households have a little bit more income. They might be able to keep their kid in school, Because a lot of times also what happens is that they don't maybe have to pay school fees, but they have to pay for clothes, they have to pay for books, certain things. During the lean season, they don't have those resources. So the kid drops out. And then the next year, they put him back in school, but the kid missed 3 or 4 or 5 months of school. They start behind, the kid can't perform, the kid, gets frustrated, the family gets frustrated. Dropout happens a lot, not because they don't have access to schools, but because they've missed so much of school, they can't keep up with it. The family can't afford tutors, they can't catch up that window kind of, right? So that's lost. And so that income effect can have a big impact, I think, much more broadly. So I think there have been a number of ways, right? There are solutions around storage. There are solutions around production. There are solutions also, kind of more towards the other end, like fortification, like improving the processing, getting private sector much, much, much more involved. In Uganda now, the bins are actually, WFP has no role. The bins are sold by the private sector. It's all kind of, the government actually provides some support to certain households, to poor households. But I think there are definitely solutions across that, the whole food system. And it's identifying, like through bottleneck analysis, like a similar kind of analysis, which ones to do first. Sometimes it's an easy fix, sometimes it's the biggest problem. And then I think just moving kind of, to improve that. Once there's conflict, right, then those systems crash even further. And so then we're really in there trying to, kind of plug holes as opposed to strengthening the system. I mean, we do both and we keep trying to do both, but in Yemen right now it's really difficult. People are not paid, they have no incomes, ports are closed so food can't get in. It's very difficult to prevent starvation in that context. Had we analyzed the situation much better in advance, we would have already knew what some of these things were, and maybe they could have been addressed very early on. I mean, you can't necessarily stop war, but maybe you can stop starvation that results from war.
So we have a hard stop in about 5 minutes. We can take one more question. If it's a short question and short answer, then we can have the second question and conclude. Okay, go ahead.
Okay, hi, my name is Seth. I'm first year MPH in global health. I actually wanted to ask a question about transitions. I think Lynnda mentioned something about transitioning in terms of climate change. I actually was thinking about it in a different context for countries that are basically transitioning from the issue of food scarcity now to having a lot. I'm thinking specifically of Ghana. I'm from Ghana, and I know WFP has a program there. And I don't know, there was a recent article in the New York Times about the explosion of KFC and stuff like that over there and how they are adopting Western food choices. So does the WFP have any specific program that basically targets countries like that are transitioning from scarcity to now probably overabundance and trying to prevent them from developing future public health crises in terms of, diabetes, obesity, and things like that?
So before I hand over the microphone, I just want to say there's a book that's going around. Please write your comments about the event today. Who is this question for?
Saskia, go ahead. You want to? Well, I was just in Ghana a week before last, but we've also done Fill the Nutrient Gap in Ghana as one of the pilots, right? So I'll let Saskia do and then I'll add if I need to.
Yeah, so basically you're talking countries becoming middle income, right? So you go from low income to middle income, and then you get a much more diverse situation. Your food system from being traditional goes to mixed and to modern in certain parts. So yes, we are present in those countries. In Latin America, we're present. We're present in Ghana, for example, present in Indonesia and other countries in Asia. And there, that issue is really there. So, for example, when we do school feeding, we say do no harm in school feeding. So the emphasis is on nutrition and more, and also on working with the different players to try and move in the right direction. But it's, of course, a very complex field. Many players, many influences. But yeah, we are a part of it, and we are engaging with the different sectors and trying to see where can you make a difference, how can you steer it, in a good direction, but also realizing, you know, how much can you do. But it starts with the awareness and with the different players holding each other also accountable for where do we want to go.